Okay, so why don't you go ahead. What we'll do is after I put the electrodes on you, I'll just have you relax in your lap.
Okay.
Or maybe we'll leave it on the table, that way the rest of you can. Typically, when you're dealing with a patient, you would just have them relax in their lap. That's the most natural way. So we'll do it this way, and I'm going to turn this at some point so you can see it as well. But for training purposes, we want our other reps and people to be able to see what the difference is on the screen too. So
Okay.
so I'm just going to make sure electrodes don't like lotion, so we'll just make sure the skin's really clean. Now, each one of these electrodes can probably be used, they say up to 40 times. I think if you get 20 to 30 out of them, that'll be pretty good if you treat them right. So put a little water on them before you put them on the patient, put a little water on them, get rid of the skin cells. When you put them back on the plastic and stick them back in that Ziploc bag, there's 20 that comes with this, so that gives you enough for 20 patients. So you can like put maybe first initial, last name, or however it is that you want to be able to make sure that that patient's got their own electrodes. So you're not putting these on motor points, you're putting them on the belly of the muscle. So just put it, that's a really good seal, and you want all of the electrode to be nice and down around the skin. Now, if you have a patient with a real hairy arm,
Yeah,
you're gonna have to shave them.
Okay.
So this is the ground. So these are the two that are going to pick up the signal. This is a ground that can either be here or underneath this arm up here.
Does it work with other electrodes if they're sensitive skin, or?
We have sensitive skin electrodes if you have, but I mean, I very rarely have anybody that has any problems with these electrodes. So if you did have a patient that did, we could get you some out, but these are really, I don't think I even have anybody asking for them actually.
Okay.
So basically, you're going to turn the device on, and typically we would go ahead and set the stem right now, but if she moves at all, it's going to pick that up. So I'm just going to go through the program and show you what's inside to change, and then we'll set the stem. So as long as you're hitting the program, that takes you through the whole entire options you have here. So that first, when it's in program mode, if you hit it once, it'll go to threshold. That's where if you want to increase or decrease the threshold, you can do it here manually. Here, press program again, you're in the rest period. You can expand that to a longer rest period if you want. Like I said, if you just want the patient to rest longer even when it's in the ready mode, that's an option for you too. Here's where you pick the mode. So it's in stroke rehab mode. If you hit the arrow up or down, it'll get you into the next, which I'm in the stem only mode right now, so that's turning the EMG part of it off, so you wouldn't be able to actually engage the NeuroMove in the neuroplasticity process, or the spinal cord injury mode. So this is where you would do that. Hit the program again. This is where you can change the parameters. Anywhere you see a down arrow, you want to hit the down button once, and then you go back into program to go within that area. So it's showing to change parameters the down arrow. This is where you can change the frequency, the pulse width, the stem period. The stem period is going to be 5 seconds. If you wanted a shorter or longer, I don't know why you would want that. The ramp on and ramp off time for the NIMS, the range, and the treatment time. And then if you hit it one more time, if you had changed anything, that gives you the factory defaults, and it's asking you, do you want to set the defaults? Showing you the arrow, that's where you would hit it, and then the defaults are set, and it tells you defaults are set. Then you hit the program again, and it takes you next. You're kind of out of that parameter loop, and it tells you how much battery you have. You need to be at 80% or above. So if you're at 80% or below, it's not going to have enough to do the program for you, so you need to plug it in. But it's at 99 right now. Oops, somehow I jumped. Here's where the audio is. You can turn the audio on or off. Hitting it again gives you compliance data. So if I hit the arrow, because it's showing you an arrow, that tells me 16 hours, 20 minutes, and it's been used 23 times. So if you were checking on a patient to see what their usage was, that's where you would do it. And then you hit the program button one more time, and it's going into the mode of where you do the therapy. Okay? So now we have to set the stim. That's the first thing you do after you put the electrodes on. So you're going to want this, it starts out at 0, you're going to want this to be at 12 milliamps or above. There isn't really an average of what a patient is, it just depends on what you can get a good contraction out of them. If it's just a little bit and you're not causing them any pain and they don't really want you to do it, at least you've got some and you can build from there. So do it slowly. I kind of jump up to 12 quick and then I go a little slower after that. So we are at 12 right now and we should be able to see some contraction here. There we go. Get it a little bit higher. That's good. We'll stay with that. Okay, so if you hit the program button again,
Relax.
we want her to relax. So right now, I just want you to focus on your breathing in and out. Put everything out of your mind. We want to get your background muscle noise nice and level on the screen.
Ready.
Even though it's in ready, I don't want you to start thinking about anything yet. So if you'll notice the screen, it's just picking up, your muscle has noise coming out of it. That's what we're seeing on the screen. The more relaxed you can get and the lower you can get that, the better. So we'll just let her relax a little bit more. So it's picking up her movement, so we want her to be real still.
Oh, I just moved my arm.
Yeah.
Okay, that's fine. Okay.
Relax.
Okay. So if you can see here, the threshold came way down. It's realizing that she's having a difficult time. And
Ready.
we actually need that.
Good.
The threshold is not, is it buzzing you pretty good?
Yeah, oh, yeah.
Is it hurting?
No.
Okay.
Not at all. It just,
Relax.
I think, when you stimulate it, it doesn't relax as quick.
Yeah. All right. Close your eyes. We're not actually getting you very calm right now. So without moving your hand, this is okay. I want you to start thinking about, because we got you pretty low right there, I want you to start thinking about something that you're going to do with your hand. Something you do right now that really causes you to visualize something real in your mind. So what are you thinking of?
Kind of climbing a cliff and just grabbing the rock.
Okay, open your eyes and look at that visual on the screen. And imagine that this is the rock, and I want you to be reaching up and grabbing the rock, okay?
Good.
Good job. Sometimes that is what will make a patient go over the edge. It's just seeing something in front of them to actually, so you can, sometimes it's easy for a for a patient to visualize something, sometimes it's not, and sometimes they just need a little visualization for reals to be able to put them over the edge. So you came way down here, so that's good. You must
Ready.
be anti-stress since you passed that first little section. Okay, let's do that again. You have some real nice straight muscle noise there, so let's go ahead and do it again.
Good.
See how easy it is for you now? Sorry, we might have a little the flopper.
Pretty stimulating. I had the rock and then I fell. No, but yeah, no,
Okay, let's do it
actually-
one more time. See, we want it to get nice and flat. Okay, go ahead. And I want you to just reach up and grab that rock and fling yourself over the top.
Good.
Do you guys see that difference there? Now see, that is what you want. You want that nice low stuff and then real differences. I mean,
Relax.
she's got real good visualization, so that's perfect. Okay, we'll switch out. Good job. So thank you so much for allowing me into your facility. I appreciate your time. I really, really want you to work with as many patients as you can during this month trial. It's 30 days, but then I actually build 15 more into it. So at the end of 30 days, when you have the option to buy or not buy, and I know you're going to because you're going to see so many good results with these patients, that you can start the PO process and I won't take your device while you're doing that. So appreciate you so much. Call and ask questions. You guys have my emails, you have my cards in there. If you have anything that comes up that you don't understand, I'm happy to talk to you. So thank you very, very much.
Thank you.